Hi, this is Feng. Now I'll introduce how we develop generative AI models for clinical trials. This is our recent efforts in building foundation AI models for clinical trials, which we call a Panacea. The aim here is to adapt a generalist AI model, such as the Mistral, to clinical trial specific AI model, namely Panacea. It generally has two main steps. In the first step, we inject the clinical trial knowledge into the model by trial align. While we leveraged 1.3 million clinical study documents and 793,000 clinical trial documents to enhance the model's understanding of clinical trial documents and be familiar with the vocabulary. At the second step, we create a set of instruction datasets with 200,000 examples, and this example further allows the model to follow the user's request to conduct a series of clinical trials without further fine-tuning. So these tasks including trial search, trial summarization, trial design, and patient recruitment. So after this instruction tuning, we get a model and we can apply it to a various sets of clinical trial tasks. On the right-hand side, we have the experiments for results for trial summarization and trial design, where we compare our model with a set of other generalist AI models, as well as the medical-specific AI models such as Apaca, Meditron, and we find that our model generally achieve accurate performance across multiple clinical trial tasks, and is better compared to the other AI models. To further enhance Panacea into AI writing assistant, we need like AI augmented PDF parsing pipeline. Here, we've collected many clinical trial documents, and most of them are in PDFs. So we have this AI pipeline to extract the text following their table of content in this structured format. And also we have extracted their tables. Some important tables like schedule of assessments play a critical role in protocol drafting, as well as the figures and their captions. So at last, we get 80 gigabytes plus big database from 35,000 clinical trials and 52,000 documents, including the full protocols, ICFs, and SAPs. So we got millions pages of these clinical trial documents, and we can further enhance Panacea to an adaptive AI model just for clinical trial writing. And this adaptive AI model can then help practitioners following their provided documents, for example, the template of ICFs, to write a lot of clinical trial related documents, including but not limited to ICF, SAP, protocol, study report, and other forms they usually encounter when communicating with IRB, with FDA, and so on. We have the experiment results showing how Panacea can augment the writing for some important clinical trial sections, such as criterion, study arms, and outcome design. And we find this Panacea model is generally much better than the other AI models. Now, Ben will present how we integrate these generative AI models into our application to help users draft their clinical trial documents.